A low insulin lifestyle encompasses more than just a low carbohydrate intake. Optimizing all of the pillars of health will assist in keeping your hormonal regulation at an optimal level and helping you achieve good metabolic health. This includes your diet, exercise habits, mental health strategies and models, as well as your sleep and sleep quality. In this short video, I'll run through some strategies and some science around sleep and improving sleep. Optimizing sleep and stress management is critical to good metabolic health. A good night's sleep has the potential to improve physical and cognitive performance. Studies in shift workers have consistently shown poor metabolic health and erratic appetite is strongly linked to poor sleep. And sleep's quite individual, but it pays to read and understand this fantastic book, Why We Sleep, a comprehensive guide by Dr. Matthew Walker. There's two major neurotransmitters he outlines. Adenosine, which is a chemical that builds up through the day and creates sleep pressure, and this one's blocked by caffeine, and melatonin, which is more specific to sleep and promotes and maintains sleep, and it's produced at night when we're deprived of light and stimulus. It's your major driver of the circadian rhythm. So we should be aiming for 8 hours sleep per night, and you can't control your waking time easily, but you can teach yourself to sleep at the same time every night. Questionnaires like the Munich Chronotype questionnaire can help you understand if you're more of a night owl or morning lark, and you can then match this, where possible, to your lifestyle. Sleep quality. It's important to go to bed in a good mood, and so imagery and visualization can be helpful for many. It's not really like turning out a light when you go to sleep. It's more like landing a plane, and it helps to have a good wind-down regime. Dimming the lights and getting away from technology at least an hour before bed can help, as well as creating a list of things to do if your mind is stressed out and worrying over multiple things. One particular stress-inducing pattern is checking your email first thing in the morning, and this can lead people to have light sleep during the night. If you have difficulty getting to sleep, or what's known as increased sleep latency, you should continue to work on your bedtime routine and be patient. Avoid daytime naps and excessive caffeine, and that will help keep the adenosine levels high so you can fall asleep fast. The strongest stimulus for wakefulness is light. It's important to shut out light using adhesive blinds for maximal darkness if you're looking for optimal sleep quality. Noise can also impair sleep quality even if you don't wake up. And sometimes investing in some multiple earplugs can benefit people who have a loud environment. Lowering room temperature is also known to improve sleep induction and getting off to sleep. So what is sleep phase? Well, this refers to whether your circadian phase, your body clock, matches the available time for sleep in your lifestyle. For example, parents with young children often have interrupted sleep because of the difference in their body clocks. If they fail to sleep when the children sleep, they'll then also accumulate sleep debt, which can impair performance. This requires planning and sacrifice to work out how you can meet the needs of your individual body clock within the context of what's going on in your external world. Now, sleep hygiene. Some of the important ways we can avoid poor sleep quality all hinder around our behaviours around sleep. We should be avoiding computer screens and phones and technology for an hour before bed and using dim light only after about 8 p.m. The bedroom is for sleep and sex only, and there should really be no TV in the bedroom. Developing a routine for bedtime is critical. There's evidence that taking a shower or bath, as well as the scent of lavender, can reduce sleep latency and improve sleep quality. Another tip, I credit this to Dr. Matthew Walker, to avoid the gravitational pull of technology is to only use your phone when you're standing in the bedroom, not whilst lying in bed. If you're a heavy snorer or people have noticed you stop breathing at night, you could have sleep apnea. There are 4 main phases that sleep can be classified into based on their characteristic brainwaves and their function. We shift between these phases through the night and repeat that shift about 4 or 5 times in what's called a sleep cycle. Here you can see a typical sleep cycle. Broadly, we have the awake state at W, rapid eye movement, or REM sleep, and then we have non-REM sleep, which is further divided into 3 depths, so to speak. Under normal conditions, we need to pass through to the deepest non-REM stage before we can get to REM sleep. Now, REM sleep is starkly different to the other phases in that it's got a characteristic synchronicity of brain waves with high electrical activity of neurons firing rhythmically in waves together. This results in what we observe as rapid eye movements with complete relaxation of the skeletal muscles of the body. Scientists believe that we evolved this relaxation to stop us from acting out our dreams, which stops us from hurting ourselves or others while asleep. This is the phase of sleep where we dream, and scientists have recently discovered that this serves the purpose of clearing toxins from the brain, such as amyloid proteins, which are characteristic of Alzheimer's dementia. Channels between the neurons and support cells of the brain, called glymphatic channels, allow these proteins to be flushed out of the brain tissue. In most patients with obstructive sleep apnea, it's the tongue which has an increased accumulation of fat that falls back and blocks the airway during REM sleep when the muscles of the oropharynx relax. Oxygen levels fall to a point that triggers arousal, and this competes with the brain's hunger for REM sleep, starving the brain of its ability to clear toxins like beta amyloid. So even if you think you function fine on 4 to 5 hours sleep, chances are you're depriving your brain of its ability to clear toxins, especially if you have untreated sleep apnea. Sometimes this is obvious with heavy snoring, daytime sleepiness and poor concentration, but sometimes more subtle signs relate to the hormonal and neurotransmitter dysregulation, with things like increased blood pressure, mood disturbance, and appetite disturbance being the hallmarks. And many patients with sleep apnea are completely unaware. Weight loss improves sleep quality and often averts the need for invasive investigations and treatments. Now, sometimes there's a paradox that you need to improve sleep quality to lose weight. And in these cases, I would recommend you consult with a respiratory specialist who deals with sleep disorders to take this on further. I hope you found this video useful. I create these educational videos to help empower patients by allowing them to understand their problem, treatment options, and the expected recovery. Please remember, this lecture is for educational purposes only, does not constitute the giving of medical advice, and no patient-doctor relationship is formed.